Distinguished guests, ladies and gentlemen, dearest friends, it is with great pleasure that I join you today to address the event jointly organized by the Indonesian Pediatric Society, the Indonesian Society of Hematology and Transfusion Medicine, the Thalassaemia Indonesian Foundation, the Indonesian Thalassaemia Parents Association, and the Thalassaemia Movement, marking indeed the International Thalassaemia Day 2023 under the theme, Be Aware, Share, Care, Strengthening Education to Bridge the Thalassaemia Care Gap. The Thalassaemia International Federation, TIF, is grateful for the praiseworthy endeavors that both eminent medical societies and patient organizations in the country have put forth for this important national meeting, to include discussions on a wide range of topics spanning from the diagnosis and screening of thalassemia to the disease's pathophysiology, management of complications, and comprehensive care. We are very pleased to note that the event aptly reflects the goals of TIF's Be Aware, Share, Care theme for International Thalassaemia Day 2023, aiming to sensitize every involved and relevant stakeholder to the realities of thalassemia and the needs of affected patients, to share knowledge amongst healthcare professionals, and to promote thalassemia awareness amongst the community at large, to improve existing policies and develop new disease-specific ones that will facilitate patient access to quality health, social, and other care, and to ensure that decision makers and competent authorities recognize the value of effectively controlling this disorder, which, if left unaddressed or even suboptimally treated, will inevitably lead to significant medical, public health, social, and economic repercussions. Ladies and gentlemen, dear friends, while thalassemia represents a serious healthcare challenge in Indonesia, with the gene carrier frequency and incidence of beta thalassemia being high in the indigenous population, the country has indeed succeeded in offering patients substantial supportive thalassemia services, such as blood transfusion, iron chelation, complications monitoring, psychosocial support, and a comfortable transition from child to adult clinic, and at the same time in developing national guidelines for the management of transfusion-dependent thalassemia available in the country since 2012, while it has made considerable efforts in the past decades to control the disease's prevalence. Success and achievements are present today in many areas of the region, and these needs to be pointed out and highly commended. However, there is still room for further improvements, especially in the areas of disease-specific public awareness and education, prevention, programs, and other relevant policies that require national coordination and funding, and very importantly, patient access to necessary treatment across the country, and especially in rural areas where a great number of affected populations live. There is a need to improve collaboration between care centers and medical and nursing specialists, and to monitor the outcomes of patient care, providing reliable information on the age distribution of patients across the country. This enhancement should be coupled with the development of a national registry and a national prevention program to provide the opportunity for families to avoid new affected births, which will allow the saving of resources, improvement of the quality and extension of disease-specific services, while at the same time safeguarding the sustainability and resilience of the national health and social care systems. Our federation, TIF, is very privileged to have established long-standing collaborations and productive relations with government officials, involved healthcare professionals, patient associations, and patient advocates in Indonesia throughout the years, collaborations that indeed led to very fruitful outcomes. It is our sincere and undivided commitment to continue our joint fight, strengthen and expand further our relations, and work in the country. We are indeed very confident that in unity, we can achieve even greater progress for the benefit of our patients' health and well-being. Dear friends, Indonesia is a country whose governments have focused considerable work and attention throughout decades on prioritizing thalassemia in the national health agenda, despite many other health, social, and economic challenges. I am certain that this good work will continue and further expand to multiple directions. Dear friends, across the globe, more than 70% of the thalassemia patients are deprived of their basic human rights for decent health and social care. Patients with this disease are still largely lacking safe and adequate blood, safe, effective, and continuous supply of key medicines, chelation drugs, for example, multidisciplinary care and psychosocial support, elements that are indeed crucial in addressing effectively this complex genetic disorder. Let us continue to fight with the same passion, solidarity, and work together towards taking patients with this disease out of misery, pain, disappointment, poor health, poor quality of life, and social exclusion. I am confident that you all agree that people in such conditions have their basic human rights hugely violated. And as TIV, we cannot accept such resultant inequalities. Indonesia has both the humanitarian approach, academic and scientific competence, and the genuine interest for its people's well-being. And there is ample evidence to support that a lot has been achieved, while efforts are still ongoing for further improvements as innovation is now well before us. Thank you for giving us the opportunity and the opportunity to Thalassemia International Federation to address this very important initiative with such esteemed participants, and congratulations on this great occasion for which TIV would like to firmly state its undivided support. I wish you every success in your deliberations, and thank you for your attention.